Similar to the situation in the UK, the Delta variant is currently the greatest threat in the US to our attempt to eliminate COVID-19. Good news, our vaccines are effective against the Delta variant. Conclusion, we have the tools, so let's use them and crush the outbreak.
That is Dr. Anthony Fauci warning about the rising threat posed by the so-called Delta variant. Joining us now, the Surgeon General of the United States, Dr. Vivek Murthy. Dr. Murthy, good to see you this morning. So tell us more about this Delta variant. We've been hearing about it more and more over the last couple of weeks. The bottom line seems to be, as Dr. Fauci said, yes, it's dangerous, but if you are vaccinated, you are safe against it.
Well, Willie, it's good to see you this morning as well. And the Delta variant is a great source of concern. Let's talk for a moment about what it is. It is a variant of COVID-19 that is significantly more transmissible and may in fact be more dangerous in terms of causing severe disease than even the Alpha variant or the B.1.1.7 variant that we were dealing with earlier this year, and certainly much more transmissible than the version of COVID we were dealing with over the past year. So what does this mean for us? Well, if you are vaccinated, the good news is you are in good shape because the vaccines have shown to be effective, specifically the mRNA vaccines, and we have good reason to believe the J&J vaccine will likely be effective too against this variant. But if you are not vaccinated, Willie, that's where the great concern is, because this spreads much more easily than the other versions of the virus. And we are now seeing some cases with increases, and Delta seems to be driving part of that. So the Delta variant is now more than 20% of cases here in the United States. That has risen rapidly. So the key messages here is get vaccinated quickly. It is the safest way to protect against the Delta variant and other variants that we've seen.
On the question of vaccinations, it does seem like the country has bumped up against a ceiling here where the White House, you all had hoped to get to 70% by the 4th of July. The White House announcing it was going to fall a bit short of that number. You have some southern states where 32% of people have been vaccinated. At this point, it does feel like anybody who wants to be vaccinated, there's really no excuse not to. It's become so accessible, easy to get. There are all these incentives state by state for people to get it. How do you tell somebody who said, I'm just not going to do it, to get vaccinated?
Well, Willie, it's a really good question. And I want to just say, looking at the larger arc of this vaccination effort, we've actually come a long way. We've administered nearly 320 million doses of the vaccine in people who are 30 and up. We've got 70% of the population vaccinated. Where we're going to, where we're going to need to do more work is in the 18 to 26 population in particular. But here's what we're learning about why people are not getting vaccinated. For some people, it's an issue of access. That access is becoming much, much easier now. For some people, it's a question of motivation. There are some people who are wondering, for example, is it so important for me to get vaccinated as they see cases come down? The answer is absolutely yes. The Delta variant is one reason. But the other big reason, Willie, is misinformation. We know 2/3 of people who are unvaccinated say that they either believe or think that myths out there about the COVID vaccine may be true. So we've got to do more to make sure that the misinformation that's being spread on social media and through other means is countered by trusted voices in local communities. That's why we're mobilizing and working with doctors and nurses and faith leaders and other influencers in communities to make sure people get the right information so they can make the right decision for their health.
Hey, Dr. Murthy, it's Jonathan Lemire. Willie is certainly right that any adult American who wants to get a vaccine can get one. But one population that can't yet, of course, are children. So can you give us an update as to the latest thinking on how much of a worry the Delta variant poses towards children? And what's the latest in terms of a timetable as to when children might be expected to be vaccinated?
Well, John, I really appreciate that question because I'm a dad of 2 young kids who are 3 and 4, so they're too young to get vaccinated right now. We don't have a vaccine for that age group yet. So I think about this all the time. And here's what I would say. There's a narrative out there that kids don't have to worry about COVID-19. I would differ with that. I would say that, in fact, we've seen many children be infected by COVID. And while they, by and large, do much, much better than older adults, we have seen many children hospitalized. We've had, a small number of children who have actually died from COVID-19. We have many young people who have actually struggled with long COVID symptoms. These are shortness of breath, fatigue, headaches, and other symptoms that linger for months after the infection. And what we have in the vaccine is an opportunity to take a low risk of bad outcomes and make it even lower for our children. The Delta variant makes this more urgent because we know that this is spreading rapidly in unvaccinated populations. Those include kids. And finally, let's just remember this, that every time we get vaccinated, we form part of a wall against this infection. And that wall protects our children who can't get vaccinated if they're under 12. So that's why it's so important for all of us to step up and get vaccinated, because we'll build that community immunity that protects the most vulnerable, and that includes our children.